Quisiera pasar con Dean Schillinger ahora.
I would like to give the floor to Dan Schillinger, the topic of diabetes in the United States. I can tell that the incidence and prevalence of diabetes is even higher in Mexican migrants in California. Why? Why is diabetes affecting poor populations, vulnerable populations? Question. First, I would like to say thank you. It is a great honor to talk with Juan Rivera, the topic of this.
So the question was, why is the incidence and the prevalence of diabetes so high among Latinos in particular in the United States and other vulnerable populations? As Dr. Rivera said, diabetes is a multifactorial disease with many, many causes. We describe it as really a social phenomenon. And as such, socioeconomic status and immigration status, which is associated with socioeconomic status in the United States, is strongly associated with type 2 diabetes. As in Mexico, the prevalence of type 2 diabetes in the United States now is 14%, 14%, but among Mexican Americans, it is over 23%. So essentially 1 in 4 adult Mexican Americans has type 2 diabetes. The person on the street would probably say that's because Mexicans are genetically vulnerable to diabetes. Those of us who work in primary care and in the social sciences understand that this is almost certainly a result of a complex array of social stressors, including poverty and food insecurity, wherein families cannot afford fresh fruits and vegetables, a problem that has been increasing over time, and can only afford calorie-dense products with a lot of added sugars. So food insecurity. Stress in and of itself, the stress of poverty, has been shown to be a factor in how fat is deposited and how we become resistant to insulin. Lastly, the problem of poor access to care leads to long periods of time where people with diabetes do not know that they have diabetes. So we see similar disparities, inequidades, in the complications of diabetes among Mexican Americans in the United States, where we have 2 to 3 times the rate of preventable complications like blindness, kidney failure, stroke, etc., among Latinos in the United States. So, and then add to that language barriers, which are a significant barrier to receiving the kinds of public health messages that Dr. Rivera was talking about, leads to a phenomenon in which 1 in 4 Mexican American adults has diabetes. And if you think about this from a family perspective, this means virtually every family is touched by diabetes and the complications of diabetes, amputations, etc.
Now, there's a tendency to blame the victim. You're fat because it's your fault. You're diabetic because it's your fault. What is it that you can do? What is it that UCSF and the state of California are doing to mitigate the blaming, the finger pointing?
Right.
And what can we do in terms of communication science to address that problem?
Thank you. Well, I mean, I think to begin with, I want to say how valuable the collaboration has been between the University of California and our partners here in Mexico, UNAM, Instituto Nacional de Salud Pública, Instituto de Nutrición. Together, we have been able to tackle multiple parts of the elephant, and one of the parts of the elephant is how do we communicate about diabetes as a society? And certainly in the United States, I can't speak for Mexico, but we have a history and a legacy of a concept called rugged individualism, which means you're a tough cowboy and everything that happens to you is because of the decisions you make and the strength of your character. And that plays out in how we talk about diabetes in the United States. For example, a recent study of all the press articles that had to do with obesity and diabetes showed that about 10%, only 1 in 10, mentioned any of the social determinants of diabetes, with the vast majority talking about individual bad behavioral choices or genetic predisposition. So we believe that in order to tackle the problem of diabetes as a social problem and to begin to develop the political will to move in the sort of ways that you have already demonstrated can be done in Mexico, we need to change the conversation about the causes of diabetes. The first way we have decided to do this is by focusing on youth, adolescentes, because in the epidemic of tobacco, we had secondhand smoke was our key, right? The fact that you smoke and I get sick or my child gets sick is unacceptable, and therefore it's a public health problem. In type 2 diabetes, we don't really have that. If you want to drink your Coca-Cola, go for it. You're just lazy and addicted. But why should a child get type 2 diabetes? We have been trying to frame the problem of childhood diabetes as the secondhand smoke equivalent, like we saw in tobacco, with some good success. And we are taking it one step further, both in Mexico and in California, by trying to engage young people to develop messages about the social determinants of diabetes, messages coming from their own mouths, coming from their own voices. In the United States, we're doing it through a program related to poetry or spoken word, which is kind of like a rap poetry combination, very effective. And in the city of Mexico, you are doing it through forms of music and rock and pop. There's a campaign called El Dulce Veneno that is really harnessing the voices of young people from affected neighborhoods, talking about the problems they see in their own family, both the diabetes and the social drivers of the epidemic. So I think we have to focus on the young people in order to change people's minds.
One final question for you. Do you think the experience of Mexico with the sugar tax law will be exported to the U.S. and other countries? And what do you think about the industry reaction to all of this?
Yeah, so let me first say that Mexico has been absolutely, the Mexican experience and leadership has been absolutely essential to anything that has gone on in the United States related to the tax on sodas, as well as other public health measures. Mexico has been a true leader in that regard, and I think California is close behind. We have had recent successes in California, but only at the municipal level. That's where the action is right now, at the municipal level or county level. We've had 5 cities that passed a soda tax in California. We also had Chicago and Philadelphia, very large cities that don't have a history of progressive taxation. We now have 5 additional cities and 2 states that are considering it, states now, Massachusetts and Washington, that are considering it in this year. The results of the impact analyses that Juan described, which was a collaboration between INSP and UCSF, were absolutely essential in moving forward the soda tax measures in the San Francisco area, as well as allowing funding for the Berkeley evaluation that showed very similar impacts to that of Mexico. So we're beginning to see the same story evolve as it relates to sugar tax. I will just add that we are also seeing other kinds of measures, getting back to your question to Juan, related to warning labels on advertisements for sugar, saying, warning, if you drink 1 or more of these a day, it could contribute to obesity, diabetes, or tooth decay. We are seeing institutions that are banning the sale of soda for their employees. We are seeing programs that incentivize poor people to buy fresh fruits and vegetables through cash incentives. So we're beginning to see, I would say we're at the tipping point, I don't know how to say that in Spanish, but la punta de cambio, in terms of people's thinking and policymakers' involvement in the diabetes epidemic. As far as your final question related to industry, not surprisingly, they have been fighting this with everything they have. A typical municipal tax vote, the for tax side will be outspent between 10 and 20 times. $20 for every $1 spent will be spent by the industry to defeat the vote measures. That's a lot of money in a lot of different cities. More importantly, they have begun a campaign that I think falls more into the category of conflicts of interest, which I know are also an area of interest here in Mexico, wherein they are trying to create scientific controversy and doubt as to the veracity, the truth of the association between sugary drinks and junk food and diabetes. So, for example, they recently published a review, a systematic review of all the guidelines ever published related to added sugars. World Health Organization, US dietary guidelines, United Kingdom, Australia, etc. And they concluded that all of those guidelines were based on poor science and should not inform policymakers.
Why don't we allow that for a discussion from the public as well? I would be interested in hearing from Juan later on. But let me move to other panelists. And I have